I'll be talking about nursing implication in regard of people experiencing homelessness. It's important for nurses to develop understanding um, the unique challenge and stressors that this population is facing, and it can be a range of physical, emotional, and social challenges, such as lack of access to healthcare, limited access to food and shelter, exposure to violence and trauma. So, nurses should be aware of these challenges and prepared to provide culturally competent and compassionate care. It's also important to build trust and rapport, and where and because nurse should listen actively and non-judgmentally and be sensitive to people that experiences that experience that going through different experiences and needs. It's also important to provide a comprehensive health assessment. um, it's important to identify and address health needs of this population, as they can range to multiple issues, and also the fact that it's important to have as many information that is being needed to help them, while we con- while we while we are in contact with them. It's also important to address barrier to care, such as lack of transportation, difficulty to obtain identification, and difficulty to access insurance. So we should be aware and be prepared to advocate for them. It's very important to collaborating with other providers, um, such as case managers, social workers, mental health professional. It is important for it is important that nurses um, should be inclined to be doing teamwork, so the patient can receive the best care possible. It's also important to provide them health education and resources, um, as we mentioned about it in patient education. The topic with the people experiencing homelessness can be very wide, and it's important to be prepared to educate them as much as possible. And it's also very important to evaluate outcomes and to see if the program, the education that we are providing, are effective. And nurses should be prepared to measure outcome and monitor and report on the health and well-being of the patient. Thank you so much.